Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today we welcome Kashica Webber-Ritchey. She's an assistant professor of nursing. Her KevinMD article is titled Nursing for Change, Prioritizing Black Nurses' Health and Well-Being. Kashica, welcome to the show.
Thank you for having me, Kevin.
So we'll get into your article in a little bit. Just briefly share your story and journey to where you are today.
Yes, so thanks for the introduction. A little bit about myself. I am a public health researcher for over about 8 years now, as well as I have about 10 years of clinical practice in the areas of medical surg, intensive care, and outpatient ambulatory surgery. And I've been working at DePaul University School of Nursing as assistant professor since 2015, and that's located in Chicago, Illinois, Lincoln Park area.
All right. So tell us some of your areas of interest when it comes to your research.
Well, my areas of research is dedicated to reducing health disparities. One of my program of research that I'm building on is looking at childhood obesity in African American children and looking at the role and incorporating the parental role in reducing childhood obesity in this group.
All right. So before we get to your article, tell us a little bit about those disparities, maybe some data from your research.
Yes, so particularly in regards to this piece, as I said, my research is dedicated to reducing health disparities. I kind of walk you through to how the piece came to be.
Yeah.
Well, the first confirmed COVID-19 case, which we know in the U.S., was reported on January 21st, 2020. It appeared quite contained, but accelerated quite rapidly. And so my thought process during this time, beginning in March 2020, me and my team, we were hearing these stories of the devastating impact of COVID-19 on people's lives and what our fellow colleagues were witnessing while practicing on the front lines. And so the question that we wanted to answer was, how can I, as a nurse scientist, support our nursing colleagues that's on the front lines? And so the examination of nursing practice during COVID-19 was born. And so what we did was conducted these semi-structured interviews among 100 U.S. nurses to get their experience. And I'd like to note that our 100 U.S. nurses that we interviewed, we had a diverse sample with respect to 63% identify as being a member of an underrepresented racial and ethnic group. And so just that we're all aware of, we were seeing that how COVID-19 impacted the lives of all, but was seeing how it was disproportionately impacting Black and Brown communities. And nurses, they're working in these settings, serving underserved communities. So there was some dialogue that was brought on early in the pandemic among scholars, healthcare professionals, and researchers in that highlighting the role that social determinants of health were playing in the disproportionate impact of COVID-19. And to dive into social determinants of health, these are those conditions in our environments where people live, work, learn, play, worship, and age that impact our health, that impact health functioning, as well as the quality of life. And so specifically, what I wanted to know too, with our diverse sample of nurses, I want to know about the experience of Black nurses. So I was able to serve as the lead qualitative investigator of a team of 8 in analyzing the interview transcripts of the 20 Black nurses to get their experience from that larger qualitative study. And what we found was the presence and absence of social support, and was our main theme that revealed, along with some sub themes that was consistent with House's 1981 conceptual model of the 4 types of social support that exist. And that is emotional support, and that involves the provision of empathy, care, and trust. Appraisal support is the communication of information that's relevant to self-evaluation, and informational support, that is providing information about the environment that can aid in problem solving process during this time. And lastly, instrumental support, the provision of tangible aid such as goods and services. So Black nurses were shared their accounts of how there was absence and presence of those four types of support. But
So,
in some, it was social support was inadequate for them.
so when you talk about the lack of those four social supports, so
Mhm.
tell us some stories of what exactly would that look like in those
Yeah.
families without social supports, just to really paint us a picture.
Yeah. So these nurses, they were looking for support within their organization. So when I say the presence and absence of support, like the nurses during this time, they said they were being, having lunch, fed lunch and given cupcakes in the break area. But that really wasn't what was needed during this troubling time for them. It was more so needing adequate communication so they could do their jobs, given that this rapidly changing work environment that they were seeing while practicing.
So, what other findings did you have from that research study? What other things did they report back to you?
Oh, well, there was stories of saying like how that when I say presence and absence, there were presence of emotional support. So for example, from their family and friends. So a story that I just remember very quite vividly was that one of the participants shared how their friend was at the grocery store
Hmm.
and called them on the phone asking them, knowing that they're working these long hours and experiencing this devastating time, like, can I get you some groceries? And that was a form of support that they found very helpful. It's just how can they be supported and be able to make it through this time?
So, in response to the findings from your study, what are some solutions or fixes that you would
Yes.
recommend?
Great question. So, what I recommend is that the most important one I do like to point out is that it was great that we were able to get a good diverse sample and have these 20 Black nurses to participate in our study. I asked that at this time that we continue this dialogue of hearing the voices of these Black nurses so we can find out how we can better support them in doing their job.
What are some specific ways healthcare institutions can do that?
Yes, I would say one of the specific things that I would recommend is that we develop some type of strategic approach. And this strategic approach cannot be developed without having Black nurses having a seat at the table in developing these strategies. And the ultimate strategy that we need to figure out is how to optimize their health and well being as they're practicing and being able to do their job.
So, in your study, you're showing that Black nurses have a lack of these supports, and also
Mhm.
during the professional workplace, they're facing all the issues that's affecting pretty much every healthcare professional during the COVID as well. So,
Yes.
so it's a tremendous amount of stress that Black nurses are facing, both at home and at work.
Mhm. Yeah, as you mentioned that, yes, nurses as well as other healthcare professionals was feeling this strain. I like to point out though that a recent survey highlighted of how nurses are one of the most trusted professionals, and so being able to support them is really important since they have this, the patients they really rely on nurses. So it's very important to figure out how we can make their work environment better.
Now, if you didn't have a study like this,
Mhm.
would the voices of Black nurses would they normally be heard?
No, and that's why I like to I'm glad that this study allowed the opportunity to engage to start this dialogue. And I feel like this dialogue should be continued. And really we should be conscientious of making sure that we're getting their voices and making them feel welcome to share their experiences so they can be heard.
So, what are some other ways that underrepresented minorities can get their voices heard, especially in the healthcare field? What are some other ways they could share their voices?
Gotcha. So when we're conducting our study, is that making sure that we get some diversity in our
Yeah.
samples, so we can that is the key to just making sure we're conscientious about that, of making sure that the sample is representative of these populations that are vulnerable is important.
So what's the next step? We are now talking in May of 23, and COVID
Mhm.
recently has become pandemic to endemic. So what do you
Yes.
see as the future in terms of addressing some of these inequalities when it comes to underrepresented groups in healthcare?
Well, what I see is that taking time to really reflect on what we went through, and are continue to go through and learn, from this experience, and apply what we learn just in future health emergencies and other pandemics that I'm sure that will come in this world. But we can learn. There was a lot of lessons learned that we could develop strategies to prevent some of those things that occurred during this COVID-19 pandemic.
Any findings from this study that was unexpected, that surprised you?
Oh, what surprised me? Okay, yeah. One thing that I like to point out is that while we were able to learn about the Black nurses' experience of how they felt that there was, presence and absence of this of social support, these sentiments were echoed across our 100 U.S. nurses. So, for example, one of the studies that came to be that's published, I want to say in Sage Open Nursing,
Mhm.
and I looked at moral distress. Moral distress was heightened across our 100 nurses. And yeah, definitely those we need to really focus in on how we can prevent those things from happening. Just not even not doing just a pandemic, but just being able to help nurses do their jobs from data on a day-to-day basis, and having that supportive infrastructure.
We're talking to Kashica Webber-Ritchey. She's an assistant professor of nursing. Her KevinMD article is titled Nursing for Change, Prioritizing Black Nurses' Health and Well-Being. Tell us some of your take-home messages that you want to leave with the
Yes,
KevinMD audience.
yes. Well, my take home message is that the collaborating is the key. And when we're collaborating, making sure that we're collaborating with all populations to make sure their voices are represented, and we can really make some powerful changes in doing that. Black nurses practicing during COVID-19 experienced this significant amount of stress, and that's important to point out because, as well, I said, nurses in general are working in these underserved communities. Black nurses practice in the area that they're a member of. And so it's very important to understand how to help them navigate in the challenging work environments. And as I said before, and I do like to point out again, is that a strategic approach is necessary so we can better optimize their health and well-being. And we must prioritize listening to people from within vulnerable populations as well as their nurses, so we can address systematic inequities and injustice that exist across all medical specialties, and so we can achieve better health outcomes effectively.
Kashika, thank you so much for sharing your time and insight. Thanks again for being on the show.
Okay, thank you and have a great day.